Hi everyone, this is Dr. Will Adams. I'm a chiropractic physician at Miami Spine and Performance in Hallandale Beach. I'm also a strength and conditioning coach. I want to tell you a little bit about myself before we get into the nuts and bolts of what we're going to talk about today. So, my background is being a strength and conditioning coach at the collegiate level. I worked with wrestling, football, basketball, baseball. Then I transitioned and went to chiropractic school to get a little bit of a deeper understanding into human movement and biomechanics. And since then, I've become really fascinated with martial arts, both personally and in my practice. So I work with a ton of martial artists. I would say between 30 and 40% of all the patients I see are either grapplers, MMA athletes, kickboxers, or Muay Thai athletes. So I've gained a lot of experience working with martial artists, and today we're going to talk specifically about grapplers. And with grapplers, there's one injury that I see most common. I would say maybe 50% to 2/3 of the grapplers that I see in the clinic generally have some sort of neck injury. And of those people, a good percentage of the neck injuries aren't from some sort of violent neck crank or guillotine or choke, because that kind of stuff does happen in jiu-jitsu. I do have people that come in, they get caught in a nasty guillotine, a crank, some kind of arm in choke like that, and their head will get cranked a little bit. They'll get an acute injury that lasts 2 days to 2 weeks, something like that. So we'll treat that in one way. Generally what I see is people that have neck injuries after training over a long period of time, things that are more consistent, things that are more chronic in nature. So maybe it's something that they've been dealing with for 6 months, 1 year, 3 years. And every time they go out on the mat, they are kind of babying a neck injury, and it continues to get worse. Usually there's some sort of tipping point where they go to training, they hurt their neck, and it may be right after training, or it might be that next morning where they get up and they just can't move their neck. So I want to talk a little bit about the neck itself, kind of biomechanically, talk a little bit about what the demands of jiu-jitsu are as far as the neck is concerned, and then I'm going to give you guys a specific exercise or a strategy that you can use to reduce your likelihood of having these recurrent chronic neck injuries. Because there are some things that are difficult to prevent, but as far as the neck goes, a lot of these injuries can be prevented. So the neck is a very mobile spinal joint, or a collection of spinal joints, right? So we can look down, we can look up, we can go forward, backwards, we can turn, we can drop our ear side to side. So the very first thing that we look at when we're dealing with someone's neck is their ability to basically complete those 8 fundamental neck movements independently, right? Can you touch your chin to your chest? Can you look up at the ceiling so that your chin is somewhat parallel with the ground? Can you turn so that your chin's over your clavicle? Things like that. There's a number of things that you can do for your neck mobility, right? You can see a therapist, you can have somebody work on the soft tissue, you can go to a chiropractor, you can have an adjustment, you can stretch on your own, you can do mobility exercises on your own, right? One thing that's commonly brought up with jiu-jitsu is functional range conditioning. So one of the things that I'll have my guys do is they'll go through a neck car, which is essentially a movement in which you combine all the different movements of the neck into one. So you're kind of hitting all those angles at once. And I'll have them go through that before they grapple, before training, in the morning, before bed, things like that. Kind of make it a daily thing just to keep that neck motion fresh. And that is an issue that I see in grappling a lot. Generally, grapplers tend to have stiff but not stable necks. Okay, so they're stiff, they don't move very well, they don't turn side to side, they kind of have more of a pillar of superficial muscle, but their neck is actually generally sort of unstable, right? A lot of grapplers do neck exercises, which is good, but they're not always doing those neck exercises intentionally or focusing on the right muscle groups or right areas that actually intrinsically stabilize your neck, right? So for example, what grapplers are doing for their neck a lot of times is crunches, sit-ups, and things like that. They're neglecting to do planks, anti-rotation exercises, some of those more stabilizing movements, not necessarily the movements that are going to give you a big, bulky neck, because we know a bigger muscle isn't necessarily a more stable muscle. So one muscle group that we really want to focus on for neck stability is the deep neck flexor group. And if we have good stability in our neck, coupled with good mobility, that's going to allow us to do things like invert, like quickly change positions for sweeps, escape out of submissions, use good head pressure, use good head position in grappling, right? Head position is everything, especially if you have more of a wrestling-based game, more of a standing takedown-based game. You want to have a good head position. When you're passing the guard, when you're pinning dynamically, you want to have a good head position. And so what we need for that is the deep neck stabilizers to be activated, because those are truly the muscles that stabilize your neck, your cervical column, right? The group of joints that goes from here, the base of your skull, to the top of your upper back. Those are the joints that get injured. Those are the joints that are vulnerable if you don't have good deep neck flexor activation. And to put it very simply, what the deep neck flexors do on a very fundamental level is what's called chin retraction, right? So it's this movement here. Right? So bringing your chin straight back. Many people are very comfortable in a protruded position, right? When we sit naturally, when we watch a ball game, when we're on our laptop, we kind of sit with our chin in front of our sternum, right? We don't spend a lot of time with our chin in line with our sternum. And a lot of times when I have people do this exercise for the first time, even if they're great athletes, they have almost no ability to do it, right? Their cervical spine is not willing to accept that kind of loading movement. And their deep neck flexors are completely deconditioned because they've sort of overtoned all the big muscles, the upper trap, the levator, and things like that, and they've neglected the small stabilizer muscles. So I'll start people with just a seated retraction and just get them comfortable doing that movement. And you'll notice I'm using 2 fingers. I like to add a little bit of overpressure just to get a little further through the movement, because not only are we working the muscles, but we're teaching the joints how to accept that load. If your joint hasn't moved in a particular direction in years, it's not just going to allow you to do it, right? That movement's going to feel blocked, it's going to feel stiff and uncomfortable. So we want to kind of give a little extra pressure just so the joint feels comfortable there. So I'll tuck all the way back and I'll push. That's a good starting point. But that's really just to introduce you to that position. The exercise I really want to get to is a position based on the DNS model, which is based on developmental kinesiology. DNS stands for Dynamic Neuromuscular Stabilization. That's one of the things that I'm certified in. There's certified practitioners throughout the country. And it's based on the idea of looking back at the different positions that you use from 3 months old up through about 14, 15 months, and going back to those positions to reactivate the muscles that you learned how to use back then. If you ever watch, 99% of little kids, they move incredibly well. Everything seems to be working right. You don't feel like muscle tone. They can sit in a squat for 10 minutes, no problem. And that's because they are fresh into that stabilization system. They have all the right muscles stabilizing where they should. They have all the right muscles moving where they should. And they don't have overlap and sort of imbalances of muscle tone, bad joint movement, bad neurology, which unfortunately happens to a lot of people as you get into your 20s, 30s, 40s, etc. You just have years of bad habits that lead to that. So the position I'm going to show you guys is going to be face down, and this position is very similar to when a child first learns how to prop his head up, his or her head. So I'm going to go here on my stomach. And the great thing about this position is I can actually work that chin retraction with gravity pushing straight down from the back of my head. So what I'm going to do is I'm going to put my elbows in line with my ears. I'm going to lift my hands up off the table. And what I'm going to do is I'm going to actually push out through my elbows so that I activate my shoulder blades. I'm going to extend my upper back and I'm going to tuck my chin. Okay? So it's going to look like this. Come down. I can also go up a little bit higher and come off of that chin tuck, but notice how I'm not kinking at my neck. You don't want your neck to look like kind of when you bend a hose and you get that little kink. You want a nice smooth curve. So I'm not looking all the way up. I'm just sloping my upper back just like that, right? So again, we're gonna start with just the chin tuck. You will feel this in your lats and your shoulder blades a bit. Then I'm going to go to a full 3-month position. This is going to bring in a little more of the upper back. Again, if we can free up the upper back, We can take pressure off of the neck, particularly that junction where the neck and the upper back meet. That's where most of the injuries I see are. And then once we get comfortable in this position and we get ourselves propped up, we can actually add rotation. All right, so I can go nice and slow and add rotation. Now you can make this position even more challenging by progressing to the 4.5 month position where young children start to go from a symmetrical position, right? My arms and legs are symmetrical, and they start to crawl one leg forward and go into a contralateral pattern. Now what happens here is when I have one leg forward like this, I no longer need my right elbow for stability because I have my right knee. So now my right knee and my left elbow are stabilizing. I come up into the same position, and now I have a free limb, right? So you can put weight in this limb, you can put a band in it, you can just move your shoulder around, right? I can open up through here and open up the upper back, all the while keeping a good position of the neck. You can do it on the opposite side, right? Now I have freedom with this limb. And in the meantime, I'm supporting my own neck, so I'm not cranking it into extension. I'm keeping my neck supported by using my upper back. Come back into this position. Chin tuck. I'm not squeezing my shoulder blades. I'm spreading them out, creating a nice tall foundation. Activating all the small stabilizers of my shoulder blade. Even the stabilizers of the rib cage are working here. And that is the 3-month prone and the 4.5 month prone position. So I recommend that you guys use that on your off days as sort of like an activation exercise. It's a great thing to do pre-training, but remember, with any exercise, 75% of the efficacy is the intention of the exercise. So don't just go through the motions, pushing yourself up and down. Make sure you're feeling the right areas. Make sure you're not building extra tension in your neck. When you get up from the table, you should feel the back of your neck, the back of your skull, and in your armpit rib cage area, because you're activating the serratus anterior by pushing yourself away from the table, and you're stretching your suboccipital muscles in the back by activating your deep neck flexors. Over time, if you train this as part of your warm-up, you use it on your off days to continue to train, your body will eventually take it up as its new favorite motor pattern for sport and activities. It's not going to carry over to jiu-jitsu immediately, but eventually it will become your subconscious stabilization pattern, and you'll be able to protect your neck and have a much lower chance of a non-contact or a chronic neck injury over time due to poor stability. So give that one a try and let me know what you guys think. Thank you for tuning in.